Good afternoon. Thanks for joining Family Caregiver Alliance for tips to boost emotional health during the pandemic. I'm Calvin Hu, the Education Coordinator at Family Caregiver Alliance and your host for today. So for 4 decades, FCA has been working across the Bay Area and the nation to improve the well-being of family caregivers. We offer support through consultations, classes, workshops, retreats, publications, and also advocacy. You can learn more about us or access our online resource center, CareNav, at caregiver.org. So during the webinar, if you have any questions, please use the Q&A box on your screen. We will answer as many questions as we can at the end of the webinar. We're also going to be asking you to give a little bit of feedback at the end, and I'd certainly appreciate you all in advance for filling that out. And then finally, the webinar is going to be archived, so if you do have to leave early or something comes up, we will get that on our YouTube channel. So today I'd like to welcome our guest, Tiffany Pippin. Tiffany is a licensed clinical social worker and also a practicing psychotherapist. She has over a decade of experience working with children and families around issues of anxiety, depression, trauma, and also family caregiving challenges. She provides a warm and also culturally competent environment so you can feel safe to express your thoughts, feelings, free of judgment, and also criticism. So now that you know a little bit more about today's presenter, I'd like to turn things over to Tiffany.
Thank you so much, Calvin, and welcome everyone. Thank you so much for joining us today for this wonderful webinar on boosting our emotional health. I really do appreciate you taking your time out of your day to join us. And I also want to thank FCA for asking me to present on this topic. This topic is near and dear to my heart. And so thank you for giving me the opportunity for this. So yes, just a little bit about me. As Calvin said, I'm originally from Seattle, Washington. I attended Washington State University, earned my Bachelor of Arts in Sociology, then moved here to the Bay Area to attend graduate school where I earned my Master of Social Work, earned my clinical hours after that, and became licensed as a clinical social worker in May 2017. I have over 10 years of experience in the field of social work. 2 of those years I did work for Family Caregiver Alliance as a family consultant. I really enjoyed working for this organization, and I learned so much about family caregiving. In addition to my professional work, I've also have personal experience as a family caregiver, caring for an elderly aunt as I was in graduate school. But then also last year, my dad had a pretty severe stroke, and I was the point person for all of the doctors and care staff. And then I also cared for him physically after he was discharged from the hospital about a month and a half later. So yeah, I definitely understand how our emotional health can take a toll if we're not mindful. So again, thank you so much for joining us today. Okay, Calvin, next. So for today's agenda, I want to touch on how the pandemic has impacted our mental health. I want to identify healthy and unhealthy habits, tips for creating healthy habits that last, healthy habits action plan. So, if there's something that you want to incorporate in your life, back into your life, or start something fresh, how do you do that where it makes sense for you? I want to talk about mindfulness and how you can incorporate that into your life. We'll do a review, and then I really do want to save some time for any kind of questions. And if I can be of support and answer those, that would be great. And then at the end, there's some resources for you and then references. And I'm glad to know that this will be archived. Okay, next, Calvin. Okay, mental health and the pandemic. So I know we're a little over a year out in terms of when this pandemic started, but we know that mental health has definitely been impacted. So in my line of work as a psychotherapist, I meet with family caregivers as well as people from other populations, and we know that anxiety has increased. Depression and depressive symptoms have definitely increased and is on the rise. Financial hardship due to job loss and businesses closing. We know that substance abuse and alcohol use has increased. Stress, overall stress has increased. Social isolation, which can impact, depression and anxiety, loneliness, and sleep disruption. And this list is definitely by all means not exhaustive, but these are some of the common themes that I see in my practice when I'm meeting with people and even talking with friends and family who are family caregivers and those who are not. These are some of the themes that are brought up. Okay, next. So, the behavioral and emotional impact of COVID 19, just to continue that, we've noticed that once we found out about COVID, so talking about last year, um, we noticed an increase in social media binging. So, meaning people were, on their phones a lot, whether it be on Facebook, Instagram, TikTok, Twitter. And I also want to add to that media in general. So, watching the news several hours a day, or just kind of keeping the news on the television screen or on your computer screen all day and getting pinged updates on your phone. We noticed in terms of behaviors, overeating comfort food. So due to stress and the uncertainty of what has been happening, people navigating to unhealthy habits like overeating comfort foods. We saw a lot more of panic purchasing, panic buying, the toilet paper, paper towels, cleaning products, foods, due to the uncertainty. And so, how that really caused some people to over purchase. Um, Another thing that we're seeing in terms of impact is not having structure. So, for those who started to work from home or for those who were laid off, uh, losing kind of the structure of their day and not really knowing what to do. And so losing some of the work life balance and just balance overall. That's been a huge emotional impact for people. We saw the decrease in physical activity. So being in the house, being indoors, not moving our bodies, sitting down, um, kind of all day. And especially for those who are working from home, so they're kind of staring in front of a computer screen, not getting up, not moving their body, the blood is not circulating. Another thing that I see often during this time is comparison. So, especially with social media and even the news, but comparison on how you may be living your life versus how other people are living their life and how that can take its toll emotionally on someone, especially within families, within friendships, with people who might be housemates. That comparison, and if you disagree on lifestyle choices, that's been a huge topic of conversation. Next. Okay. So I have a question for you. Have you found yourself engaging in unhealthy behaviors during COVID? So when you're thinking about this, I want you to really try your best to avoid any kind of shame. I want you to look at your life and some of your own behaviors. And if there's anything that you would deem unhealthy, can you identify them? And why do you consider them unhealthy? And can you identify a specific trigger that might be contributing to your engagement in this behavior? So, for instance, isolation, uncertainty, financial hardship, limited structure, relationship stressors, in general, feeling overwhelmed. So take some time to think about that. Okay, so hopefully everyone's been able to think about something that maybe they would deem as an unhealthy habit or something they started doing due to something else. Okay, all right, we're going to go to the next slide. So I want you to put a pin in the unhealthy behavior, and we're going to pivot just a second on healthy habits. Okay, because this is just kind of a reminder. And again, this is not an exhaustive list. But what are healthy habits? Healthy habits can look like ensuring that you're hydrated, drinking lots of water, physical activity, taking a walk around your neighborhood if you can, reading, taking a break from the computer screen or the phone screen, getting in nutritious foods like fruits and vegetables, protein. It can look like ensuring that your space is clean. So if you feel like you haven't been maybe keeping up with your home as much as you would have liked, taking time for that. Stretching. Gentle stretching is really good for our bodies and our blood circulation. Socializing. So catching up with a friend or a family member, whether it be via Zoom or FaceTime, or meeting up for a socially distanced walk or a check-in. Grooming yourself. So those self-care habits of bathing, taking care of your oral health, checking in with your doctor if you've taken a break from that due to COVID and everything kind of going telehealth. Maybe checking in with your doctor and going in for a physical. Okay. Healthy habits can include hobbies and interests and allowing yourself to explore that and identifying your support. And so, when I mean by identifying support, can mean formal support. So, Family Caregiver Alliance would be considered a formal support system. Finding a therapist that you connect with would be a formal support, or a support group, whether that means meeting virtually or even a socially distanced meetup, if you can do it. What are your informal supports? So that could be a neighbor, a friend, a family member, a colleague. Taking time to identify your support systems. And then my favorite is mindfulness. Mindfulness can be a wonderful, healthy habit to incorporate. Also, daily routine, having an evening routine. I hear often in my practice people feeling like they don't have structure, so they don't really have a routine set up. Once they started to be at home more and more, they lost that structure that they had pre COVID. And so taking time to reflect on what can a daily routine look like for your life, and also an evening routine, especially for bedtime. Okay. Next. So here's another reflection question. What were some of your healthy habits prior to COVID? Let's think back. What were you doing? What hobbies were you into or activities? What were your personal connections like? Spirituality, your health, beauty, self care. What was that like before COVID? I know for me, activities, I used to enjoy going to dinner with friends. That was really important to me. And in terms of personal connections, spending time with my colleagues in the office. So before we all went to telehealth, we all had offices and we just hang out in each other's offices on lunch breaks or go for walks, go to the grocery store across the street and grab lunch. That was all a part of my healthy habits and self care. pre-COVID, of course. Beauty self-care, whether it's a massage, getting your hair done, going into a store to purchase something that you like. What were some of the things that you enjoyed doing that you would see as healthy and self-care? Next slide, please. So now that we know what we've been doing that may be unhealthy, we reflected on what we used to do that was healthy pre-COVID. Let's think about what we would like to do now in the present, today. So part of it is creating a healthy habit that lasts. So the first part is having awareness. What would you like to do? What's important to you? And how can you make that work in your lifestyle now? Given what you know, given your circumstances. So the second step is once you identify what you like to do, you make a plan. I personally enjoy writing things down. I feel like if I don't write it, it's kind of a fleeting thought for me. So writing it down, making a plan with that, perhaps using some type of calendar to stay on track. Think about the future. How will your healthy habit that you want to incorporate impact you in the future? And lastly, but to me most importantly, be patient and have grace with yourself. It takes time. Next slide, please. So more specifically, you think about your plan, right? We have our awareness about it. So your plan should be specific. So for instance, I want to start walking more. Okay, is that specific? Not so much. But perhaps if I say I want to start walking more 2 times a week for 30 minutes at noon, which is my lunch hour. And I can write it down in my calendar that I use daily. And I can track with a star every time I meet that goal. So you want to think of something that's specific, that's measurable, achievable, and relevant to your life today. So looking at your life in a realistic manner, and pick out something that you're interested in doing. And give yourself a time frame. Next slide. So mindfulness. This is my favorite topic. Mindfulness is wonderful. I use a lot of mindfulness techniques and breathing techniques in my practice with my clients. Mindfulness can be practiced often. It's a great way to pause for a self check-in and also to slow down, to bring awareness to how you're feeling, to your breath. You can choose the type of day when you want to do it. It can be a repetitive action, and it encourages you to take deep breaths And again, slow down your mind and your body. It's a great way to recenter and recharge. So a great technique that I typically practice with my clients is called the 5-5-5 breathing technique. This is a great way to breathe yourself into calm. So I'll give you an example of how to do it. You want to inhale through your nose for 5 seconds. 1, 2, 3, 4, 5. Exhale very slowly through your nose or mouth for 5 seconds. 1, 2, 3, 4, 5. Wait for 5 seconds. Then repeat. Inhale through your nose for 5 seconds. 1, 2, 3, 4, 5. Exhale slowly through your nose or mouth for 5 seconds. 1, 2, 3, 4, 5. Wait for 5 seconds and repeat. So you repeat this breathing process 3 times for 1 minute total. The goal is for you to feel calmer, recentered. I typically practice my mindfulness before I begin my workday. After the morning rush is done, after my kid is at school, before I begin seeing my clients. And then after I'm done with work, before I go home and take off my therapist hat, I practice this breathing method to recenter. So think of a time in your day where this may be helpful and give it a try. Next slide. So points to remember regarding boosting your emotional health. Focus on what you can control. That looks different for everyone. Identify healthy habits that you would like to incorporate. And if you're already doing some things that you see as healthy, that's wonderful. Continue to do it. As you identify new habits that you would like to start, create a SMART goal. Give yourself some structure and grace. Incorporate mindfulness as you see fit. And as always, reach out for support. Again, that can be your formal support systems or informal. Next slide. These are some mental health resources that I think are useful. Family Caregiver Alliance, of course. Open Path Psychotherapy Collective, National Suicide Prevention Lifeline, my website for my practice, and also Psychology Today, where you can find therapists from all over. And you can even filter it if you would like to use insurance. Filter the search. Okay. Next slide. Are there any questions?
Thanks, Tiffany. We actually do have a bunch of questions. Some people wrote in the registration form. Other people have asked them on chat. I guess first of all, since it's a little bit fresh in mind, I know a lot of us have read about mindfulness and seen news stories and things about it. But how would you define mindfulness?
Well, for me, in the work that I do, mindfulness to me is being present in the moment, being in the here and now, not living in the past, and not being worried or focused about the future. And so allowing yourself to just feel, experience what's happening for yourself in the here and now. And deep breathing is a great way to focus on your breath, focus on the here and now. Oftentimes, our minds are thinking about the future or something in the past. And this is just a great way to slow down and focus on the present time.
So we have another question from a viewer who wanted to know what advice you might give if both the caregiver and the person receiving care, the care receiver, are depressed or having those kind of feelings of depression.
Yeah, great question. I would definitely recommend reaching out to formal support. So that could be a therapist, um, if you would like to do family therapy or even individual, like each person having their own person to talk to. Uh, a support group can also be great. Having connection with other people who can empathize and understand what you're going through is a great resource as well.
Great. We have another question. Let's see about. Okay, this listener or viewer wants to know about kind of signs of mental health issues. I guess
Mhm,
looking at this question, so say they might have had kind of self-care routines that worked fine in the pre-COVID era. Maybe
mhm,
there are things like you mentioned, seeing a friend once a week at work for, a quick, lunch and just to chat and decompress. But for whatever reason, maybe those things aren't working anymore. Maybe it's just, everything going on has been a little bit too much. What might be the signs of kind of lingering mental health issues that
mhm.
are maybe more than just kind of blue feelings or things that might be able to resolve on their own?
Sure. Some of the signs and symptoms that it's more than just kind of you're going through a little rough patch could be that you're having difficulty staying on top of your activities of daily living. So that could be grooming, bathing, um, difficulty taking care of yourself in terms of staying on top of your bills, your finances. Um, Perhaps you're not eating as much. You've lost your appetite, or you find that you're overeating. Um, you've lost interest in activities or things that you used to find pleasurable or enjoyable. I would say if that's happening probably over 2 or 3 weeks, if it's been like that long, I would reach out for support.
And actually, we have another. Let's see. We have another question that's kind of linked. It's someone who has a friend who's a caregiver who I guess is trying to manage kind of high anxiety,
Mhm,
but maybe they're a little bit hesitant to seek out help, whether it be, I guess, maybe like from a a medical professional or a medical provider,
mhm,
like a psychotherapist, or maybe just another family member.
mhm.
Do you have any advice for this person to help them maybe get their friend to maybe seek some help out, or if that is even the right course?
Sure. My suggestion would be to encourage them to do a consultation call with a medical professional or a therapist. Many therapists, before they even take on a client, offer free, complimentary 15 to 20-minute consultation to find out what's going on, to make sure that even the therapist can support that person. But that might be a great introduction to talking to someone um, before like fully committing to something. Because I know starting therapy can be very intimidating for a lot of people. And so I find doing the consultation where there's no commitment, they can just talk to me, um, kind of lower some of that anxiety a bit.
Great. And then actually, I have a question. I was wondering, so if someone is looking to maybe maybe talk to a therapist or a social worker or someone, how would they, I know you listed psychology today, and I'm familiar
Mhm,
with the sites. They, they list different psychologists and social workers and people who may be able to help therapists. But um, what would you recommend in terms of how they would go about that search and finding someone who might be the right fit?
mhm. So even on Psychology Today, I believe they have a filter system where it lists the different issues or challenges where you can select, something that pertains to you. So let's say, for instance, it's caregiving, or it's, aging, or it's anxiety. You can click that, and that'll filter out therapists who have a niche in that category. Also, you can go to your healthcare provider. So, whatever your health insurance is, you can contact them to find out who is in network with your health insurance. And so, typically, your health insurance has the most up to date, like, resource list for who they're contracted with for therapy.
Great. Let's see. We have another listener, well, viewer, who wanted to know. Okay, well, this is great. You mentioned that kind of exercise, physical activity is one of those, kind of positive behaviors, good behaviors that we all want to have. This person would want to know if you had any resources or ideas to, help them kind of encourage them, encourage them to, get that physical activity,
Hmm. Yeah, sure. Great
motivate
question.
them, I guess.
Yeah,
Yeah.
motivate them. Yeah, wonderful question. So if you go online, I know Facebook has some really great support groups for exercise, health, and wellness. Um, and it's meant to encourage, to inspire. If they're everyday people that are just trying to improve their physical health and really mental health as well, I would think. So Facebook is a great resource. Um, I know on Instagram it's a group called 510 Hikers, where they welcome people of all different backgrounds and activity, physical fitness levels to enjoy nature walks and hiking. And it's a free resource. It's to encourage people to spend time in nature. And for some folks, that might be intimidating. So going with a group of welcoming individuals can sometimes be helpful. Uh, so really trying online, looking at supportive resources and groups. They're pretty welcoming.
Great, thanks.
Mhm,
Um, Here we have another question. It's not 100% on topic, but I think with your expertise, you'll be a great person to ask. This is from a caregiver who they're a sandwich caregiver,
mhm,
so it's adult child taking care of a parent who would requires some form of care.
mhm,
Um, but they also have the child, and I guess the child, they're worried that maybe they're getting a little stressed out with all this whole pandemic situation. Now it's wound on for a year.
mhm.
So I guess with your experience with working with children, would you have any advice for a parent who's a little bit worried, but also kind of wants to give this child? It seems like it's maybe a young teenager, the kind of the
Mhm.
space, want to give them that space and that respect.
Mhm. Yeah, that's a good question. I would tap into the school system to see what they're offering for their students that's even not necessarily classroom related. So if they have any activities going on for teens, check in with your community, at the community centers or the local library. I know, like in my community, they're starting to do like friendship groups for teens, adolescents. So I would first check in with your child's school to see if they offer anything. Check in if they have a school counselor or a school social worker that may be privy to different events and activities that can be useful, for your child. And then also the community center and the library, they may have things going on.
Thanks. We have another listener who wanted to know how you might be able to ease the feeling of being overwhelmed when you kind of have this laundry list of things that's probably a mile long, and we know with COVID that the list is probably um, perhaps longer or maybe just more complicated, just trying to
Mhm.
get day-to-day things done.
Right. Um, what I see, and because this is a huge topic in my sessions, is tapping into what may simplify your life that's realistic. And so I really go back to those support systems. The informal is crucial. So again, whether that be a neighbor, a family member, friend, who can help in any way, whether that's bringing a meal over, whether that's sitting with your loved one, so you can go out for a walk if you want to, just something. So thinking about that, how you can tap into that, if at all. Thinking about how formal support system can be beneficial, and then also creating some structure to your day, and working on accepting that not everything is going to get done in one day. And
Right.
that can be tough. That can be tough, and a therapist can typically help you with that piece. But some adding some structure, looking at what support systems you can tap into, and then working on some acceptance of, I'm not going to be able to get every single thing done on my list, but that's okay.
Okay, we have another listener who wanted to know if you have any resources you might be able to recommend for older adults to help them keep motivated and also positive until the support groups can meet in person again.
Mhm.
And I guess I would preface that with um, what if their comfort or access to technology is limited?
Yeah, there could be like a friendship line, like a phone, like a telephone friendship line could be helpful. So receiving a phone call versus, doing any kind of video chat, which might be a little bit more cumbersome. So that could be helpful. Again, checking into your community resources. So looking at that community center, um, what adult day programs are offering and what suggestions they have. If they're not open right now, what are they suggesting? And contacting your medical provider. Oftentimes, they may know of resources or different support programs that are being advertised to the medical kind of facility or organization to spread the news. So, really asking, doing some research and what's happening in your own community, but then maybe asking a formal support system like your medical provider, do they know of anything? Because oftentimes, I know therapists and community providers do advertise to those entities to get the message out, to spread the word.
Great, thanks. We have another viewer who actually wanted to know about, are there any issues, I guess, going, say, across state lines virtually when selecting a therapist? So are there any particular considerations they would need to keep in mind if they lived in California, but their therapist was in, say, Virginia or Texas or New
Mhm.
York?
Yeah, so if that from my understanding, if that therapist is licensed to provide therapy for California residents, I think you should be okay. It's more about where the client is located. Um, I know there's been some lacks on that due to COVID, and with the pandemic and the mental health crisis. I think you can get temporary waivers. So you can be a therapist here in California and maybe meet with someone in Minnesota. Um, Depending on the state and how they feel, you can get a temporary waiver to provide that service. But if you're here in California and your therapist is in another state, as long as they're licensed to provide therapy for the California resident, then they should be okay.
And then so the license, presumably, they would be, in the alternate case, they would be licensed in their own state. So,
Mm-hmm.
so, so how would it benefit the caregiver if they were, licensed in California, even if they're out? Is that like an insurance thing? So it helps pay for insurance, or
No, it's well, I don't know if it's an insurance thing, but I know depending on the board that you're under, I know the Board of Behavioral Sciences, we're like, so I'm licensed to practice in California. I'm not licensed to practice in Washington State or, you know, Arizona. So if I were to want to meet with someone who was located in those states, I would have to look at that state's website to see what their say is, their stance is on that for me practicing with one of their residents. So it's really up to the clinician. It's the due diligence is up to the clinician to figure that out. Um, yeah.
okay, that makes it's similar to kind of like being a lawyer, I guess, where you're
Hmm.
licensed in individual states and you're
Right.
familiar with the laws and the
Hmm.
processes and how everything
Yeah.
should. Okay, that
Yeah. So
makes
that's up
sense.
to the lawyer, not the lawyer, the therapist, not
Sure.
the client.
Let's see, we have another listener who wanted to know. Let's see. Now, this listeners actually have feelings of guilt around being overwhelmed. I guess their view that caregiving is a duty. I don't think that's a bad thing, but they
Hmm.
they feel this duty to be a caregiver and to provide this care to a parent or relative loved one or something. But they're also feeling, I guess, guilty about being overwhelmed. So maybe again they're feeling like they're not doing everything they could or doing everything that probably that ideally would and could get done. So do you have any advice for them to help kind of overcome these feelings of guilt?
Hmm. Yeah. And so, what I would first encourage you to do is give yourself grace. You're human and you're doing, the best that you can. And given the circumstances of the pandemic and all that's going on and how it's impacted, businesses and formal support systems, you're working with what you got right now. Um, and typically when I hear about guilt, it's typically rooted in something else. And so meeting with a therapist can help you with that, or even a support group to kind of see that, other people are going through this and you know, this is how they're getting by and this is how they're thriving. So I would definitely recommend reaching out to at least a support group, and if not, a therapist, so you can work on the guilt piece. Um, because more than likely you're doing the best that you can, and nothing's going to be perfect, and being okay with that is important.
Thank you. It looks like we have another question. You perhaps already answered this, but I will ask it nonetheless. This listener wanted to know um, if as kind of I guess, a life hack, something that has maximum benefit for minimum effort. What might you recommend for just kind of overall emotional health? I know you mentioned the breathing exercises you do. Would that
Mhm.
be something that is something that everyone could do and would really have an outsized impact on emotional health?
I think so, because when I work with people who have anxiety or depression, especially with anxiety, oftentimes they're worried about the future. There's a lot of uncertainty right now. And so taking time to focus on your breath and being present in the here and now is important. And I would also add to that practicing gratitude. So sometimes at the end of the day, I recommend, identifying what went well today. What went well today? It could be something as simple as, I prepped my coffee for tomorrow morning, and, you know, I read a couple pages out of my book, and I sat on the porch and just took in some air. And so it really brings it back to kind of how you can simplify your life and how you can focus on things that are going well. It's really easy to focus on the negative And some stuff will never go away in terms of the negative, but deep breathing and practicing gratitude, especially at the end of your day, I think can be helpful. It shifts your perspective a bit. Any other questions?
Hi, Tiffany. I think we have time for just a few more questions. One I actually wanted to ask is it's on the resources right now, but the National Suicide Prevention Lifeline. I was wondering if you could maybe talk just a little bit more about how that works and what people might expect if they were to be in maybe a darker place and end up reaching out to them.
Sure. It's a great resource. It's confidential. It's 24/7, open 24/7. And if you're in a space where you're needing someone to talk to, or you're having, thoughts of wanting to self-harm, this is a great resource. It's free. It doesn't cost any money. And so I definitely mention it to anyone I know. All my clients know about it. I include it on all my resource pages when I do webinars. Um, it's just a great resource to have and to share with other people too.
Thanks. And I think we have time for just one more quick question. And this person wanted to know how have people how have you or I guess other clinicians, other therapists and psychologists been meeting with family caregivers, virtually if this person who you're meeting with are having like a hard time taking a break, how are you able to kind of carve out that time for them to meet with you?
Mhm. Yeah, so the family caregivers that I'm meeting with right now, typically they meet with me in their car, sometimes in their car, like they're parked outside of their house, but they're in their car. They may have another loved one watching the person that they're caring for. So whether that be a neighbor or a family member or friend, so they're able to, so that again, they're tapping into that informal support so then they can access their own formal support, which is me. And it's, we meet weekly at the same time. And so that's often helpful for the people who um, are helping the family caregiver because it's a set schedule. And so that's one way. The other way, the person is at home, and so they have some privacy and they're able to meet with me virtually. And we do telehealth, so it's video conferencing. I can see them, they can see me. And if they have to put me on hold for something or go check something, you know, they're fine with doing that.
Okay, perfect. Thanks so much. I think that is about all the time we have for this presentation. I'd like to thank everyone for joining us today in today's webinar. This was again presented by Tiffany Pippin. Tiffany, actually, as a side, I'm sure you heard her mention she was at FCA for a couple of years, but at the time I was also the education coordinator just towards the tail end, and we always heard great things about Tiffany when I met the caregivers at events. So we're happy to have her on the line and to welcome her back. Next month, we're going to be covering journaling for caregivers. So that one, you want to bring a notebook and a pen for that one. We're going to be doing exercises, journaling exercises. You can find more about our webinars at caregiver.org. So thanks again, Tiffany, for joining us today. We are going to put up a quick evaluation. So we'd certainly appreciate if you could fill those out. But I think for now, we're done for this time. And again, thanks for joining us. And thanks for spending your afternoon with us, Tiffany.
Thank you. Thanks for having me. Take care.